So today let me show you how you use these clotrimazole pessaries. So these medications called clotrimazole pessaries are medications which you are given and you are told to go and insert them inside the vagina. So today I'm going to show you the procedure and how to insert the clotrimazole pessaries. So clotrimazole is an example of antifungal medications which we use to treat yeast infection. So yeast infection is also called candidiasis, and this is an antifungal urinary tract infection, or a UTI. It is both a UTI and an STI. So it can be transmitted through sex, and you can also get this infection without having sex. It can be caused by other factors other than sex, which include mainly due to poor vaginal hygiene and other factors which I'm not going to mention in this video. So yeast infection or candidiasis has the following signs and symptoms. Number one, you will experience a feeling of itchiness or an irritation in your vagina and in the areas around your vagina, which we call the vulva. The neighbors of your vagina or the area surrounding your vagina, we call it the vulva. So you will experience some itchiness and some irritation in those areas. Number two, you will experience a burning sensation or a burning feeling during sex and also during urination. You will experience a burning feeling in your vagina during sex and also during urination. Number three, you might experience swelling or redness in your vulva and in your vagina. So it is easy to notice the redness in people who are light skinned in comparison to people who are black in color. And number four, which is the definitive sign of candidiasis or yeast infection, is that you will notice the presence of a white cottage cheese-like vaginal discharge. So you'll have a vaginal discharge which is white in color, milky. It looks like milk or fermented milk. Inakaa maziwa ile ambayo imeganda, alafu inakaa nzito nzito. So you will notice the presence of this discharge. So this discharge can be accompanied by the presence of a smell, or sometimes it can just come on its own without the presence of a smell. So when you are having yeast infection, that is when you will be given these clotrimazole pessaries, which you need to take them for at least 6 or 7 days. So during these days, so these medications are required to be used during the night, and also during the days which you are using these clotrimazole pessaries, you need to avoid having sex during those days. So how do we use these clotrimazole pessaries? Somewhere. So both of these are clotrimazole pessaries. So it usually comes like this, whereby you find that it comes with an applicator. You are given an applicator inside them with in combination with the medications. Here we have 6 tablets. This is also the same. We are given 6 tablets, and you also have an applicator. So I've said that these medications should only be used during the night. So when you wake up in the morning and you realized that you forgot to use this medication before you went to bed, do not use this medication during that morning. Just wait until evening or the next time you're going to bed. That is when you are going to use these clotrimazole pessaries. Sometimes you are also given the clotrimazole creams. So both the clotrimazole pessaries and the clotrimazole creams work best during the night. So you need to use this medication during the night. So how do you use this medication? So first of all, you ensure that before you go to bed, you go to the toilet or to the bathroom and relieve yourself. You either defecate or urinate, so that whenever you go back to bed, you ensure that you will not wake up again to go and urinate. By the time you're going to bed, you're not going to wake up again and go to urinate. So ensure that you urinate before going to bed. So when you go to bed, you lie on your back, then you bend. You lie on your back, then you bend your knees, you elevate your legs. Then you take the medication. This is the applicator. So this applicator looks like this. So it has a plunger down here, which you can pull it back and forward. So you pull this applicator back, then you take the medication, you remove from here. So I'll use this medication here. So you put here, this part of the flange, this part of the applicator. Then you pull this back, then you put this medication here. Then you gently insert it inside the vagina. So you push it to the farthest possible. And ensure that when you are inserting the medication, you are not feeling any discomfort. So you push it to the farthest possible inside the vagina. The farthest possible you can attain without feeling any discomfort. So when you have reached the farthest you can insert inside the vagina, you just push this plunger. You push it forward. You push it forward. So when you push it forward, you remove this applicator. When you look at this drug here, you will notice that on one end it is not a rectangle. So on one end it looks like it is circular in shape or oval in shape. Then on the other hand, you'll find that it has a sharp edge. So this place whereby it has a sharp edge, that should be the point whereby should be at the bottom of the applicator. So this other end whereby it looks like a circle should be the one that should be at the top, so that this can enable you to insert it properly without having any difficulties. So after inserting the medication inside the vagina and pushing this plunger, you have to remove this plunger slowly from the vagina, so that to avoid injuring yourself and also to avoid coming out with the medication. So after doing that, that is when you can now sleep, and the medication will be able to dissolve, and the medication will go and work and destroy the fungus that will be causing you to get the yeast infection. Then you put it somewhere whereby you will clean it, then you use the following day. So that is how you use the clotrimazole pessary. So if you have any question or anything you want me to answer, let me know in the comment section below.